TAVR has really been used in mainstream medicine now since 2011, late 2011, and it's really been a game changer.
It's a procedure that's used to treat a disease called aortic stenosis, which left untreated is terminal.
Aortic stenosis is where the aortic valve, which is the last and the most important valve in the heart, it becomes narrow. As we age, our aortic valve, which is usually soft like skin, it becomes calcified like bone.
The problem is, by the time somebody's 75 years old, that valve is opened and closed about 2.5 billion times. And like any structure, it could wear out. The heart has to work very hard to open it and get the blood out. As a result, the heart eventually starts to fail.
Patients become very symptomatic early on in the disease state.
They develop chest pain, they develop shortness of breath, they could pass out, and the average life expectancy is only 1 year after this condition becomes symptomatic.
So with TAVR, we're able to fix or replace the aortic valve.
We've been doing aortic valve replacements with open heart surgery for decades now, and it's an excellent procedure, but it's a major procedure for people to undergo. And most people who have aortic stenosis are age 75 and older, and it can be very hard on them.
In TAVR, we just go up from the groin, and the new valve is mounted on a balloon. We put it exactly where the old valve is, and we prop it open, and it just sticks there. It just stays there. The old valve acts as a grout and helps it stay there. So there are no incisions made. We look at the valve indirectly with x-rays as opposed to looking at it directly during surgery.
Recovery from traditional open heart surgery would be 5 to 6 days in the hospital, and resumption of their normal activities would take typically 4 to 6 weeks. Now with TAVR, patients are sitting after the procedure in 4 to 6 hours, many walking.
Patients are back home 2.5 days after the procedure and pretty much back into their usual routine within a week. You know, it's amazing. Some patients, after the procedure is over, say, "Doc, I didn't realize how poorly I felt until after I had the procedure."
And they say, "Doctor, I feel so much stronger. I can do things I couldn't do. It's like I can breathe again. It's a breath of life."